So I think apart from discussing the exciting and promising activity data of this drug, it's always also important to point out the potential side effects of this drug. And so the most common side effects that we see with T-DXd and similar antibody-drug conjugates are not too different from the ones we see with chemotherapy, because somehow these drugs are chemotherapy, are better targeted chemotherapy that works much better than traditional chemotherapy. But unfortunately, you can still have hair loss or neutropenia or side effects that you associate normally with chemotherapy. And so it's always important, of course, to discuss also this part. And then one particular side effect that we are seeing with T-DXd and other similar drugs is an inflammation of the lungs. And so one thing that the physician might tell you before starting T-DXd or a similar drug is to always check if you feel anything weird about the way you breathe or if you have any cough. And so this is something that we are learning and that will get better in the future for sure to monitor and to prevent. But in general, we have to always be very careful about the potential lung toxicity of this drug. And so they are very effective, but we also have to know that we have to monitor for this potential side effects. And we have to know it, the patient have to know it, and all the care team, sometimes also the primary care physician has to know it, because if you start having some cough, maybe the primary care physician could think of giving you antibiotic, but it's important to know that it could be related actually to the treatment. So apart from the very exciting part of this drug, it's important to remember that they can also have side effects. And so we always have to balance this. But in general, I feel that in this field, the future is bright. And what we are seeing is that these smart chemotherapies can be slightly changed in order to work better and work in different ways. So for instance, T-DXd targets chemotherapy selectively to tumor cells that express HER2. And what we are seeing is that these tumor cells sometimes can hide HER2 in order to escape the treatment. But this is why we are developing also antibody-drug conjugates that deliver the chemotherapy toward other antigens, toward TROP2. And there is already another agent against that target called sacituzumab govitecan or Trodelvy. And then we have another one against HER3, Nectin-4. And so in general, we are learning how to deliver in a better, more effective way chemotherapy to tumor cells. And I believe that we're just at the beginning of this whole field of research that is moving very fast. So in general, I think we are already seeing some concrete benefits of this field of research, but much more of this will come in the future. And so I would just like to convey a message of hope, because good treatments are coming. We are working very hard for it. And we are very grateful for the help of all the patients, because without patients enrolling in the trials and trusting us with the new drugs, there wouldn't be any of this development. So it's really an important partnership that we are conducting day by day, and that is leading to important benefits. And so we are very grateful for this.